Dr. Ryan Stanton, and it's time to find out what's going around this week. Recently, we've seen a spike in strep throat, not only locally, but I've also heard from ERs and clinics around the region as well. Strep throat is a bacterial infection of the posterior pharynx and tonsils caused by group A streptococcus. The infection is very common in children and adults. It's characterized by sore throat, fever, headache, enlarged lymph nodes of the neck, and a red throat with white exudate. It's also a very common cause of abdominal pain in children. When I have a child come into the emergency room with generalized abdominal pain, vomiting, and fever, strep throat is right there at the top of the list of differentials. Some folks are more prone to strep throat. In fact, some are colonized, meaning that any time you test for strep, it will come back positive, even when the person does not feel or look sick. This can be important because in this population, an infection may be something else, so it's important to consider other sources of infection even when the screen comes back positive. Speaking of that, the diagnosis of strep throat is easy. It's clinical, with an exam and confirmed with a strep screen test performed with a swab in the back of the throat. Most clinics and emergency departments have this test and can have it done within about 10 to 15 minutes. The treatment for strep throat is currently antibiotics. This can be done with a one-time injection or through a standard at-home course of medicine. There is growing evidence that most uncomplicated cases of strep throat don't even need antibiotics because they will resolve on their own with the person's own immune system. This practice isn't widespread here in the U.S. yet, but I expect it to be the standard in the future. The best treatments for everyone else are symptomatic management with acetaminophen and ibuprofen for the fevers and aches. Also, topical medications for that sore throat can help as well. Other medications may be necessary based on the symptoms. Work with your doctor on the best plan for you or your child. You can join the conversation on Facebook at What's Going Around, as well as the StantonMD page. Also, follow @EverydayMed on Twitter. I'm Dr. Ryan Stanton, and that's What's Going Around.